A few months ago, at the eHealth Canada conference, I caught up with Robert Fox, CEO of OntarioMD, who shared some of the work that they were doing on the use of AI at physician practices. Well, I'm now here at OntarioMD's Digital Health Conference in the fall, and right before this event started, they released the results of that in-depth study that they did on AI scribes. As Rob Fox describes it, this study was meant to cut through the AI hype to determine if AI scribes really are as good as vendors claim them to be. I can't wait to ask him about this study and to dig into some of the results. Let's get to it. Rob, welcome back to the program.
Great, thank you, Colin. It's great to be here.
It's always fun to have you here. We always have a good conversation, so I'm looking forward to another.
Absolutely a pleasure, yes. Thank you. I'm looking forward to it.
We are here in Toronto at the OntarioMD Educates Conference.
That's correct.
So far, it's been fantastic. But more exciting than that, Rob, you've released the results of that AI study that you and I hinted at and talked about when we last got together in Vancouver. Tell me more about that report.
Well, we're very excited about it. First of all, I want to welcome you to our 20th anniversary of OntarioMD, so we're very excited about that. The AI Scribe report has been released. It is for public consumption. It is on our website, and we encourage anybody to go and check that out and really see the outcome of our study. It is absolutely a game changer how AI is going to impact on physician practice optimization and really provide value to physicians in terms of how they see patients, value for patients, but also in terms of decreased workload, hopefully a reduction in the burnout and administrative burden they're experiencing, and really an opportunity for us to show how technology can improve on the way we care for patients and how we can do that in the future with this and other technologies.
One of the things about this report that really was shocking in a pleasant way to me was just the very high percentages in terms of the number of people that were excited about AI scribes and how they were like, please don't take this technology away. I'm definitely gonna use it. We're talking like high 70s, 80% of docs were saying, I love this technology. Was that surprising to you, or was that in line with what you thought?
It actually was in line with what we thought. In fact, the whole purpose of the study was to remove the rhetoric. So people had started to dabble in AI Scribe a long time ago, and they started talking about how amazing this technology is and the opportunities it provides for patient care and practice optimization. But we wanted to put some rigor to the process and do an evaluation that had a full research methodology to it, that had biases removed, that it was a great sample of physicians. And this report was absolutely in line with it and actually validated what we thought was going to happen.
Right, so basically what the report was saying is that all that hype seems to be actually not so much hype. It's actually realistic. People are getting time back, less administrative burden, a little bit of joy, as you said, back into the practice. Those seem to be true according to the survey.
Yeah, not only that, I think that it's going to get better from here, right? Because we're at a starting point of this innovation and how it's being rolled out and the development of these tools. But as they progress and they mature, we're going to start to see more functionality that come out of these opportunities, not only with AI Scribe, but by linking it to other technologies that are already in practice or are being developed now. So I think that we have a huge upside in terms of how AI Scribe is the starting point of technology providing value to physicians and patients.
So if I was a physician or practice owner reading this report, what's the takeaway that you would want to make sure that I take from that report?
I think it's really important for physicians to make sure that they evaluate the outcome based on their own personal interests and their own method of practicing. There was a great comment this morning about how it saves 4 minutes per patient. And that doesn't seem like a lot, but it is a lot. It is a lot in the sense that it makes the interaction with the patient more personable. It's got the human side to care is being created, and the typing and the writing and the worrying about the report has been removed. So that interaction and that care model is being improved. So that 4 minutes is important. Not only that, it's taking away 70 to 90% of administrative burden on the physicians. We heard stories this morning about physicians who worry about a note that they haven't finished and they have to go home and they have to finish it, or they forget, or they're constantly pressured by getting these reports done, where these tools can help with that and remove some of that burden so they can have more time to see more patients or see their kids or have what they called pajama time this morning. So it really is an opportunity for us to leverage this tool. So that 70 to 90%, the 3 to 4 minutes, and up to 4 hours a week at a minimum, saving physicians in administrative time. And when we multiply that out to 16 hours a month, that's substantial. So these tools are the starting point of where we can demonstrate some significant value. But not only that, it's the way that patients and physicians will interact that is of real value in terms of changing that historic documentation focus to the interaction with a patient focus.
So where do we go from here? Now that you have this data, it's released, the study is out, where is OntarioMD going to take this now going forward?
That's a really important question, because now it's about how do we scale these tools out to the community for getting physicians to adopt it pervasively across the province and across the country. And I think that's a really important and sensitive piece, because there's two considerations we have. Number one is there are some risks, liabilities that we have to consider around informed patient consent, around making sure that data is captured and utilized in an appropriate fashion, to make sure that we have support for physicians in terms of how they contract with AI Scribe or other technology vendors. So we want to make sure that our contracting support is in place for them and make sure that we're centralizing around that piece. The second piece is around how do we procure this? How do we make sure that the vendors that are providing these solutions are providing a technology that is sound, that has certification standards to them that we will develop with our partners and with the ministry and Ontario Health, to make sure that we have products that are rigorous, that have value, but are also making sure that they're doing what they're supposed to do. So that certification piece is really important. And then the last piece is procurement. How do we contract with these vendors en masse to make sure that we're getting value for doctors, we're getting the best price and solutions for them, to make sure that there's some protections around contracts, and just acting as that broker on behalf of the physicians. So those are some of the considerations we have moving forward. And again, it's not just OMD, but we're going to play a key role, but it's a larger collaborative that are going to have to solve that problem.
Any timelines that you could share in terms of ideally when you would like these certifications and the procurement stuff to be done by?
Yesterday. Yeah, as soon as possible. It's a really important question. We want this to be a top priority, and we're moving as fast as we can. There's a lot of work going on behind the scenes that we can't report on yet, but it's critical for us to do this now, because as you saw this morning, by a show of hands of physicians who are adopting AI Scribe, the majority of physicians put up their hands. So we want to make sure that we can intervene as soon as possible to make sure they're protected, supported, and they're getting the best value that we can get for them. And also, who's paying for this? How can we resource this? The physicians are currently paying for it. How do we work together to support them to figure out how to get that burden down, lowered, and minimized as much as possible?
Now, Rob, I got to ask you this question. We've heard a lot about AI, and we've heard how it really can reduce workload, bring that joy back. I've heard a couple of anecdotal stories of how people are now thinking, well, maybe I won't retire in the next couple of years. Maybe I'll keep going a little bit longer because they were planning for early retirement. But we've had so many years of high burden and burnout. Is this AI Scribe arriving too late? Or do you think it will actually help stem the tide of maybe some of these clinicians leaving their practices?
Yeah, I think that's the challenge we've got. Not only do we have physicians retiring because earlier than they would have because of these challenges and burdens, But we also have unattached patients in the province. So that's a system problem and challenge of how do we attach those patients to physicians and make sure they're supported properly. I think it's a really good question, and it's a tough one to answer because really you can't do anything about physicians who have left other than hopefully we can attract them back in some type of consultancy or part-time fashion. But we need to move on this as soon as possible so that these tools are available to physicians. And when we survey physicians, they give us top 5 areas that they want to see support from a technology perspective. Number 1 is AI and AI scribe. Number 2, and in no particular order, cybersecurity support on the risks around cybersecurity. Third one is around secure messaging, so that there's proper messaging between physicians and patients and physicians and other physicians. Virtual access to care is really critical because we still need to optimize the adoption of virtual care access for patients. And then the last one is around optimized billing. How do we make sure that physicians are capturing and being remunerated for the work that they're doing in an appropriate fashion and they're not missing out on those things? So those are the top 5, but that comes under a bigger umbrella of what we call the digital practice optimization. And we're putting a plan together to support physicians on that collective technology support for their practice. And that plan is in the works now. And it includes not only those top 5, but also a number of other solutions that there's a number of vendors upstairs today that are really showing these incredible technologies. But we also need to make sure that those are valuable for physicians. We want to make sure that they're vetted. We want to pilot them and help with that and really support the rollout and adoption of technology and scaling those technologies across the province as soon as possible to help with the capacity problem of those physicians who have retired, the unattached patients, and really supporting and maximizing the number of patients we can see with the physicians we have available to us.
Rob, as always, you've shared a lot of great information, but where can people go if they want to learn more about this report?
OntarioMD website. Please visit our website. We have the report is posted there. You'll also see some microsites coming up around AI, some guidance documents, some support, any questions you may have, and also links to our consultants. OMD staff are always available for physicians and clinicians who want to get some support.
Well, Rob, always a pleasure. Thank you for being on the program again.
Thank you, Colin. It's always a pleasure, and I can't wait to give you more updates at our next meeting.
Of course.
I want to thank Robert for joining me on camera to talk about AI scribes and how OntarioMD is helping to move the industry forward when it comes to adopting this type of technology. I look forward to talking to him soon about the certification framework that they will be proposing. And hey, if you enjoyed this interview, you could really help us out by hitting that like button and subscribing. Also, head on over to healthcareittoday.com where you can find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next episode.